So, good morning, everybody. Good evening, good afternoon, wherever you are. I just want to say I'm so happy to see you for another very interesting episode on storage of health commodities practice question, which is part of the supply chain management system practice question series. And I remain Dr. Iya Ezebasi to take you through this. I want to thank you so much for your support. And I want to ask, please, if you have not commented, you've not liked, you've not shared, please do so. You've not subscribed. This is a free resource. Please keep us going. Thank you so much. All right. Question one. What is one of the key storage activities in supply chains? Well, one of the key storage activities is to receive supplies and then inspect them before you store them. So B will be your answer. Question two, what is the main purpose of storage in the supply chain? You want to be able to protect the quality of the product and its packaging. Note the quality of both the product and its packaging, because the packaging will tell you about expiry dates, it will tell you the lot number, it will tell you how many things are supposed to be inside the kit, and all the information that you need. Question number three. What does shelf life refer to? It is actually the length of time that a product may be stored without affecting its usability. Some have a shelf life of 2 years, some 1 year, some 6 months. So, all right, depending on how long before it expires or how long you can still use it without a problem, that is the shelf life. Question number four, why rather is the expiration date important? It's important because it ensures that the product is both safe and effective. For instance, if you're using kits that have attenuated microorganisms, hoping that when it's expired, those organisms have not come alive again. All right. Will it still give you the correct results, all that. That's why the expiration date is important. Number five, what is a general guideline for storing health commodities? The general guideline would be store them in a dry, well-lit, well-ventilated storeroom. All right, this is to prevent damage to the kits. Question number six, which item will be stored away, should rather be stored away from electric motors, fluorescent lights? Well, latest products like gloves usually have a way of getting melted, squeezed, burnt when they stay near these kinds of things. Question number seven, how should flammable, toxic, and inflammable products be stored? Usually, there is something called an MSDS sheet, that is a material safety data sheet that contains all the instructions that you need for storing all these kinds of products. So question number eight, what is the best practice for storing medical supplies? If you're going to store medical supplies, give them their own space. So store them separately from other materials. Question number nine, what should be done with damaged or expired products? A lot of things, people do a lot of things with damaged products, but usually you should dispose of them according to the guidelines of the product. Don't take them, go and resell them in the market. Don't destroy them carelessly. Find out what is the guideline for that particular program. There are different programs. You have the HIV program, the TB program, the malaria program, and so on and so forth. So find out what are the guidelines for disposing these products, expired products, in your own program. Question number 10. What is an example of a low cost or no cost strategy for storage? These are usually strategies that are within the storekeeper's ability, like keep it dry, don't expose them to sunlight, let them be in a well-lit area, arrange them in a certain way and all that. So C will be your answer. Question number 11, what should be ensured for cold storage commodities? You should have a cold chain. The vehicle that is transporting them must have kind of a refrigerating section there where they are stored. You should have a refrigerator or a cold room. There should not be a gap where those things are exposed to heat or high temperatures. Question number 12. Why does a physical inventory account, or what does a physical inventory account involve? Usually it involves you counting by hand the total number of units of each commodity. So it's not like sitting down and looking at the books. You have to be there physically and you have to count them by hand. You have to cite those things. So what is a visual inspection? That is a process of examining products and packaging for obvious problems. You're going to search for problems like missing components, empty components, broken components. You're going to search for things like packets that are damaged, cartons that are not labeled, or labelings that are not clear, and deal with those obvious problems. So, what is a key aspect to look for during visual inspection? You want to look for both the package and the product integrity. When you talk about the package integrity, you're talking about the cartons, you're talking about the packs, the packaging, kit. When you talk about the product, you're talking about the kit itself, its expiry date, the components that are supposed to be there. Some kits, like ELISA kits, come with different components. You want to make sure that all the components are complete. Then question number 15. What is the consequence of not addressing storage problems timely? You usually have reduced availability of commodities. All right. So question number 16. What is an important aspect of storage security? You want to be able to lock your rooms, secure them, the cabins where you're storing things, the shelves, so that unauthorized personnel do not have access to them. Question number 17. What special consideration is required for short shelf life products? These are shelf life products, 3 months, 6 months, What is the special consideration? You want to be able to monitor them regularly and make sure that they are upfront and they are rotated in a way that they can be used on time before they get expired, and you minimize wastage. Question number 18. What is a common problem found in warehouses or clinics? The common problem you have are product-related problems. Kit is not complete, the package is damaged, very short shelf life, it has expired, it's broken, it fell down, those product-related issues. So question number 19, which guideline is essential for maintaining product integrity? Keep your supplies dry and well ventilated. Okay, question number 20. What should be available and accessible in the storeroom? Office supplies, fire equipment, expired products, personal items. The only one here is your fire safety equipment. Question number 21. Before I continue, please have you subscribed? Please have you commented? Even if you don't have time to comment, just give me a thumbs up, give me a smiley, whatever it is. Just tell me I'm doing well, or tell me there's somehow you can improve. Thank you very much. All right, question number 21. How should cartons be arranged in the storage? You want to ensure that your cartons are standing up straight. So you want to arrange them in such a way that the arrows on the cartons are pointing up and the labels are visible, so that you don't put them upside down and the components of the kits leak out. Question number 22. Why is it important to separate and dispose of expired products? You want to separate them because when products are expired, you cannot ensure the safety of that product and the quality of the result is giving you. So you want to remove them and get rid of them according to the guideline or the SOP of that project or program, rather. So question number 23, who supervises the management of ARV and OI drugs in the central warehouse? Well, this is specific for the Nigerian Federal Ministry of Health SOP for HIV. Questions after this, or the Nigerian Federal Ministry of Health HIV/AIDS program. It may be different for the US, so you need to check up your own side. All right, so who supervises the management of ARV and OI drugs in the central warehouse? That will be our warehouse manager. What is the role of cold chain in storage? You want to maintain appropriate temperature for cold storage commodities. What is a potential issue with storing medical supplies near insecticides? Do you know that insecticides contain things like organophosphates? Organophosphates are harmful actually to enzymes. Apart from other things, they contain heavy metals. So you want to keep them away from medical supplies so that you don't have contamination. What is the importance of having fire safety equipment in the storeroom? That is very easy. You want to be able to extinguish fires in case you have cases of fires. All right. Question number 27. What is the impact of poor storage conditions on products with a shelf life? You will not be able to use them for long, and if you do use them, you may not have the quality of results that you do need. So B is your answer. 28. What should be done with laboratory commodities that contain cyanide? Cyanide is very dangerous, and it has been known to cause metal pipes to explode when it accumulates in them. So you need to carefully dispose of them. All right. So B is your answer. What is the impact of mixing medical supplies with office supplies? Would have an increased risk of contamination. What should be done if visual inspection reveals packaging defects? You have to address the defects appropriately. It's not just one type of defects. There are different types of defects. Defects on the cartons, names not being there, names being scratched out. You have names on the package but not on the carton, or you have names on the carton but not the package. So whatever is the defect you see, you address it appropriately. Question number, supposed to be 31, but I still have 30 here. What? Why is it important to store products away from direct sunlight? You want to maintain product quality. What's the purpose of a material safety data sheet? That's your MSDS. We've talked about that. Usually that particular document provides safety information for handling products. Question number 30 again. All right, forgive me for that one. So how many storage guidelines do we have in the Nigerian Federal Ministry of Health HIV/AIDS program SOP? We do have 12. 12 apostles, 12 disciples, 12 guidelines. So I want to say thank you very much for your time. I'm so grateful. Remember to like, subscribe, remember to comment and support our program. Thank you so much, and God bless.